Hey, Dr. Tracy, board certified general pediatrician, and I wanted to talk about mistakes that I notice teens make with regard to their anxiety and depression medication. So, first of all, if you're placed on an anxiety and depression medication, they're usually SSRIs in the teenage age group, and those are medications like Prozac, fluoxetine, sertraline, citalopram. Those are the big ones. Duloxetine is another one that's also approved in children, and certainly we use other medications as well, but those are the big ones. So, SSRIs help depression and anxiety. They're not just antidepressants, they can be used for both because the treatment is very similar when it comes to pharmacology. So, the mistakes I notice teens make is the first one is when they have a side effect, they just stop the medicine cold turkey and they don't say anything to anyone. They don't always even let their parent know, they just stop taking it. They certainly don't let their provider know, and there could be things that we could do to help with the side effects. Some side effects are no-go. You really don't want to take the medication anymore, and we can walk you through whether you need to wean down, move on to something else, or just stop it completely. It depends on the medicine, the dosage, and your symptoms. The other thing is some of these side effects are things that will get better just with how you take the medication, eating before or after, taking it in the morning or taking it at night, splitting the dosage in two. There's so many things that sometimes we can do to mitigate the side effects, but we need to know that they're happening. The next mistake that I notice that teenagers make is when they are doing better, they almost like completely forget that they had a problem to begin with, and they stop their medication. They say, I don't need medication. I'm doing fine. Again, they kind of stop at cold turkey. They don't typically wean down. I just stop seeing them in clinic. They stop coming for follow-up. I don't hear anything until they crash and burn 3 to 6 months later. So a lot of times the symptoms get so much worse, but it takes a few months. In the beginning, they feel like they're doing really well because they're at a normal high. As it starts to go back down, sometimes the low is worse than it was before. It's harder to get them to be improved, and also it takes time to get into your doctor, sadly, and we don't want you to have to wait for those symptoms to get better. So don't stop taking your medication if you're improving. If you feel like you want to wean down on your medication because you've been improving, we like to see two things. We like to see stable moods with negative depression and anxiety scores for at least 6 months, and we like to see that you haven't failed coming off of medications before. Now, anytime you want to stop your medication, that is completely up to you and then obviously your parent, but we want you to do it in a safe, appropriate way and with all of the informed consent. The third thing is not managing their daily moods. So they only kind of notice things when they're really good or they're really bad. And they don't really see the validity in having these daily scores or mood check-ins. And what I mean, this can be done with like an app, a journal, some way where you can chart how you do on a regular basis. So you can see what are triggers for you. How are you doing overall? If there's any trends, how often do you cycle? We all cycle a little bit with our moods. And so these are things that you can learn about yourself. So you can learn what is a normal cycle for you and what is abnormal, which really helps when you come in to see your provider, because a lot of times when I see teenagers, they will only tell me how they're doing that day. They really struggle with telling me how they've done for several weeks to several months because they're teenagers and they don't always know. So those are my tips and tricks for what to do when you're on a medication. And this all boils down to talk to your providers about how medications are making you feel, your thoughts and feelings about them, your questions, because we're here to help you. Take care.